Dear ladies and gentlemen, today we shall speak about enhancing laser surgeon education with Navilas laser system. My name is Oleg Parkhomenko. I'm the doctor ophthalmologist from Ukraine. I work in the biggest network of private clinics in Ukraine with 9 branches all over Ukraine, having two navigated laser system Navilas. Before the beginning of full-scale invasion of Russia to Ukraine, we planned to buy one more, but the war messed up our plans. The popularity of Navilas is connected with revolutionary properties of navigated laser system. Among them are unprecedented safety, accuracy, and efficacy. The new and unique property, which we shall talk today about, is teleguidance system with remote planning and remote observation, and also program navigate, allowing to train young doctors and experienced ones going to widen their expertise. Having 9 branches of medical centers and significant staff turnover in Ukraine, we need constant learning of new doctors. For this purpose, we established a training center, New Vision, as for internal needs of our company to prepare the doctors for different departments of our clinic in different cities of Ukraine, and for external needs, for doctors from other clinics, state and private, which want to learn from experienced doctors of our network. Up to date, 8 PhDs and 2 professors are engaged in the teaching process of our teaching center. As for me, I am responsible for teaching courses in the field of medical retina and laser treatment of retina and glaucoma. Our center is proud to receive the status of provider of credits for continuing professional education for healthcare workers in Ukraine this year. We use Navigate, a free digital learning platform for retinal laser therapy, to make the learning process safe, beginning with the theory of laser application, continuing to practical teaching of decision-making skills in a controlled environment. Students can be prepared both for continuing their practice with Navilas laser system or conventional laser machines. Here we perform the training for the doctors, mastering the laser trabeculoplasty, micro-impulse and selective laser trabeculoplasty techniques, working with real pictures of patient. Doctors make their treatment plan, placing their laser sports in different anterior chamber angles with different angle configuration, profile, and pigmentation degree. Here, the doctors are planning panretinal and focal treatment in diabetic retinopathy and other vascular diseases. During the process of planning, they are dealing with real case studies, standard and complicated, supervised by the experienced trainer. We use the program Navigate by ODOS to teach the doctors with a pattern of laser cog-light placement, their size, other parameters which look obvious for experienced practitioners but must be clarified in different clinical cases for beginners. The Navigate app is a free digital learning platform for retinal laser therapy. You can get acquainted with introduction webinar following the link below. After accomplishment of theoretical simulation training on computers or tablets, doctors can use Navilas training mode to try the simulation of treatment on each other. This is especially useful to master the non-contact treatment. The special physical fuse is extracted from the laser machine and it is turned into simulation mode with simulation of laser application on the screen, with active tracking of the retina and full capabilities of treatment mode, including OCT, image overlay, caution zone placement, and virtual laser planning. Making routinely high-quality pictures of retina periphery of each other by doctors in training before starting non-contact treatment in real patient is very important. The next step in learning of laser therapy in real patients is usage of teleguidance system, that incorporates distance learning, remote planning, and distant guidance. Distant learning allows students to observe real-time laser in the teaching room, while the expert is treating at Navilas. After observing of real cases of treatment, the remote planning model is used. Remote planning can help to engage very fast new doctors in the process of laser treatment, which had no or limited experience of working in macular region, for example, microimpulse regimen in diabetic macular edema, or central serous chorioretinopathy, or performing laser in some rare cases such as EELS or Coats disease or von Hippel-Lindau disease, etc. Also, our medical center has a group in Messenger Viber of doctors from our network of clinics, which is called Consilium, with more than 60 doctors, where we announce and perform the live laser treatment on Navilas in a standard and difficult cases. Using iFast Viewer application, clinicians connect to the server at a appointed time and see the stream of the laser surgery. All the streams were confidential and anonymous, with patient given an informed consent. Live laser stream helps to educate young doctors and is useful for consultants to prescribe non-contact laser procedures more confident, as the clinician can assure that procedure is rather simple, quick, and excellently tolerated by the patients. Working in the capital of Ukraine, Kiev, I can control the proper planning and delivery of laser treatment, which is performed in the other branch of our network in Odessa, which is approximately 500 kilometers far from Kiev. Distant guidance allows to perform the treatment for the young doctors without stress. The treatment is performed by the doctor in training, with expert remotely supervising the whole treatment process on the screen, with physically being present in the other room, but having full control over the laser system, including laser settings, planning, caution zones, having the possibility to give the cue with arrow on the screen of the laser, or giving the advice through the phone headset or earphone in the ear of the doctor in training. It must be noted that the doctor in front of the laser is always responsible for the treatment. 2 doctors in our clinic now are passing through the whole learning process from theory through Navigate app, then moving to observation on teleguidance system, then practicing on each other using the Navilas training mode, then making supervised treatment using remote planning and distance guidance. Up to our experience, it takes approximately 3 to 6 months to pass the whole course to feel confident performing retinal laser treatment. In our network of clinics, we teach in such a way 8 clinicians, which now confidently perform the whole spectrum of laser procedures with Navilas laser machine and work independently. More than 30 doctors from all over Ukraine passed our courses with the usage of simulation mode of Navilas and Navigate app, and now performing laser on conventional laser machines in other clinics. Thank you for your attention.